This webinar is a portion of the Wisconsin Pharmacy Quality Collaborative 2018 annual meeting presentation entitled Serving the Underserved, celebrating 10 years of making a difference with WPQC. For this portion of the video, we'd like to show you how pharmacists are using WPQC as a platform to provide holistic care beyond the pharmacy. By incorporating programs to promote public health and population health, more pharmacists are able to impact the underserved than ever before. The Wisconsin Department of Health Services and Wisconsin Medicaid have teamed up with WPQC for the joint mission of providing comprehensive care to those in need. The Department of Health Services has provided us a video statement of congratulations on the WPQC 10-year milestone.
Hello, I'm Tom Ingalls, the Wisconsin Department of Health Services. DHS has a long, rich history of working with the Pharmacy Society of Wisconsin. We understand and appreciate the role that pharmacists play in helping Wisconsin Medicaid members receive the medications they need for healthy outcomes. We have worked with and supported the Wisconsin Pharmacy Quality Collaborative from the beginning. And in 2012, we implemented a medication therapy management program for Wisconsin Medicaid members. Before that, our senior care program was only a prescription drug benefit. Now, thanks to WPQC, Wisconsin seniors can receive a comprehensive medication review that helps them live their best lives. As of June, Wisconsin has paid over $3.5 million for comprehensive reviews. That includes over 128,000 prescription drug claims. We've heard from our members. They value this program, and we value you. We look forward to continue work with the Pharmacy Society of Wisconsin and the Wisconsin Pharmacy Quality Collaborative. Happy 10th anniversary, WPQC.
Today, you will hear how Southeast Asian refugees are being served at the Kashia House, a Journey Mental Health Center. Kashia House is located on the Mendota Mental Health Campus on the north side of Madison. They have an on-site psychiatrist, and coordinator Mai brings in pharmacist Stacy to provide comprehensive medication reviews to refugees through the help of a translator. In Boscobel, pharmacist Michelle Farrell is tackling public health in a rural setting. She has brought the Weight Watchers program to her pharmacy, where she is making a huge impact. Amazingly, this program has facilitated Michelle's deprescribing efforts. Almost too well. She often jokes that her Weight Watcher patients are putting her out of business.
The Chronic Disease Prevention Program, or the division, is very fortunate to have PSW because you're a really strong partner and you work so effectively and collaboratively. Through the work of WPQC in accrediting and certifying the pharmacists as well as the pharmacies, that we're going to get consistent MTM services across the state. What we have to do is get those patients referred to those services. And I think we recognize it here in Wisconsin, but nationally, CDC recognizes that MTM services and the work of pharmacists really needs to be included, so that communication, the use of the EHR, and all of that work can be bidirectional, but also inclusive of the patient and their families.
So Kashia House is another one of those offshoots of Journey. So it's a Journey mental health program. It's essentially a senior center for Southeast Asian refugee population. I guess I didn't ever realize how unique it was until people started asking. And the patient population is just really different.
Many of them experience, they have a lot of family member lost during the war, and due to language barrier, this is the only program that provides service to them.
Certain things that don't translate well into their culture and their and with the language. So, you know, depression. Are you depressed? Well, of course, I had to leave my family in another country, and half my family members died. And you know, so I mean, all those things, of course, are going to make you sad. But like the concept of actual depression, I think, isn't always really understood.
Oh, well, because we have a lot of clients who are very confused about their medications. They do have a children at home who speak the language, but the children are working.
More traditional medicine that they sometimes use. So they'll have bags of tea or herbs that people have brought them from traveling home. They don't know what's in it. I don't know what's in it. They can just, they tell me what they think they're using it for, and how often they're using it, and we just kind of go from there.
It would be nice if Stacy can come in and try to work with clients to understand the medication, and then if they have a problem, communicate between themselves and the doctor, that Stacy can be the person that, talk to the client's doctor.
And we became Weight Watchers leaders. We just really felt like it was a good opportunity for the pharmacy to really highlight the public health aspect of weight loss. Grant County, the county that we reside in, it has very, very high obesity rates. So it's just one of those things that goes along with medication management that seemed like a no-brainer.
It's really convenient for me because I live 5 blocks away. But and I decided that I should do this because I did gain weight because I sat around, didn't do anything, I was just trying to live. So I thought this would be a good thing, and knowing Michelle and a couple of people that belong, I thought, well, let's give it a shot. Many nights we have 25 or so people that stay for the meetings. That's a lot. At the meeting, she'll say, put me out of business. I mean, and a number of people have gone off medications.